What clinical trials are being done for maintenance therapy?
So many of them are in the post-stem cell transplant. So if you're an AML patient and you underwent or you are going to have a stem cell transplant, you may want to talk to your stem cell transplant physician afterwards. Again, this would be after recovery from the stem cell transplant and making sure you're taking care of any things that come up afterwards in terms of side effects from the transplant. But select patients that are doing well after transplant might be good candidates to consider a clinical trial for maintenance after the stem cell transplant.
So, a lot of the drugs being studied right now in the maintenance setting are drugs that we use for AML therapy in earlier lines of treatment, but in a less intense format. So, for example, even though I didn't mention this as a maintenance regimen, currently we use azacitidine and venetoclax for many patients, particularly elderly patients. And because this therapy is indefinite until disease progression, there are trials looking at using only venetoclax or using altered schedules of these agents. Similarly, chemotherapy has also been looked at. So historically, all the chemotherapy studies before oral azacitidine may have improved relapse-free survival, but did not end up improving overall survival, which from a patient perspective is the key.
Thanks for watching. By creating a HealthTree account, you can get exclusive access to the latest HealthTree University content, track your course progress, take quizzes, and bookmark lessons. Visit the links in the description below to get started.